Howdy! Thanks for learning with me, Dr. Aaron Boster. As a multiple sclerosis neurologist, I routinely combat pain in trying to help my patients live their best life. People impacted by MS, like with many other conditions, can suffer from lots of different kinds of pain. Neuropathic pains, orthopedic-related pains, spasticity-related pains, the list goes on and on. I have had some really fantastic success using CBD pain cream in my clinic to treat patients, and that's what I want to talk to you about today. The value of CBD pain cream in treating several different forms of pain. So if you would like to up your game and maybe learn about CBD, stay tuned. So what exactly is CBD? To answer this question, I want to take 2 steps back. The human body has lots of different organ systems, many of which you're familiar with, like the immune system or the nervous system or the cardiovascular system. But there's a system in your body which you might not be as familiar with called the endocannabinoid system. So interestingly, the endocannabinoid system is a series of receptors set up throughout your body. And when they're stimulated, they alter or manipulate other systems in the body, like metabolism or inflammation or pain, for example. And your own body, the human body, makes endocannabinoids. You make your own cannabinoids that bind to the system in your body. Now, there's this plant that you may have heard of called cannabis. And cannabis plant produces hundreds and hundreds of these chemicals called cannabinoids. The 2 most common cannabinoids are THC and CBD. And when you consume cannabis and you consume these cannabinoids, THC and CBD, they bind to your endocannabinoid system because they mirror your cannabinoids that you make yourself. So when you ingest them, they bind and they stimulate that endocannabinoid system. Now, THC and CBD are very different. They bind to different receptors and they trigger different downstream effects. THC is psychoactive. So when you consume or ingest THC, it can make you feel medicated, or the old term high. CBD does not bind to the same receptors as THC, and CBD has no psychoactive properties. So you consume CBD and take a math test, not impaired. Interestingly, when you consume CBD and you stimulate those receptors in the endocannabinoid system, it has impact on inflammation and pain. Now, there's a lot of other things that CBD does, but in this video, I really want to focus on using CBD to treat pain. Number 1, there is evidence supporting CBD's use to treat chronic forms of pain. Pain from arthritis, cancer, multiple sclerosis. That's actually what I've seen in my clinic. Number 2, when CBD binds to CB2 receptors on the endocannabinoid system, what we talked about a little bit ago, it triggers an anti-inflammatory effect. Number 3, there's currently an opioid epidemic in the United States, and we are looking for alternative ways of addressing pain, safer ways, and CBD is one of them. I can share with you in my own clinic, some of my patients have dropped neuropathic pain medicines because they have found CBD does the trick. Number 4, CBD is not psychoactive. It will not make you feel high or medicated. Number 5, CBD is remarkably well tolerated with very, very low side effects. And I love knowing that when I'm offering it to my patients. There are a lot of upsides to using CBD pain cream, a topical cream. The bottle can be brought anywhere, so it's very convenient. You apply it to yourself, so you know when you need it and you know where it needs to be applied. You have control over that, and I really like that for my patients. It's got a really long shelf life, and so a bottle is going to last you a really long time and it's not going to go bad. And lastly, the pump administers a certain amount which is consistent every time. So you know if you're using 1 pump or 2 pumps, you're always getting the exact same dose. By clicking the link below, you can learn more about CBD pain cream from Refresh, Ohio. And until my next video, this is Aaron Boster saying be safe and take care.